Good evening, Honorable Mayor, Council members. I can be brief this evening given the time. Myself and our team are available for questions and addressing any issues that Council would like. To add on to staff's presentation, I wanted to share about Interfaith Community Services, an organization that many of you are very familiar with because of our long-standing deep partnership with the City of Oceanside. We're an organization with about 300 employees, a budget of about $30 million annually. We operate more than 70 programs that help people overcome poverty, food insecurity, and homelessness, exclusively here in our local communities. Last year, in partnership with the City of Oceanside, other North County cities, our faith community partners, volunteers, and donors, we helped more than 20,000 unique individuals, including, importantly for tonight's discussion, helping more than 1,000 individuals overcome homelessness, and just as importantly, preventing nearly 1,500 individuals from falling into homelessness through rental assistance and case management. Interfaith is a trusted local agency. We've been here locally for 45 years. We've had a presence within Oceanside for more than 20 years. We're a regional leader when it comes to addressing homelessness. I also serve on our Continuum of Care Advisory Board Council, and we advocate for securing federal, state, and other resources to help us address some of the most challenging issues around homelessness here locally. We have extensive shelter experience. We are honored to serve as the homeless outreach team here in the City of Oceanside, working in partnership with law enforcement to outreach into our communities on a daily basis. We have strong financial management. All of our audited financials are provided to the city, are available online. We have the highest rating from Charity Navigator, a rating that we've received for nearly a decade now, placing us in the highest 7% of charities nationwide. Most importantly, I'd say for tonight, we're very goal and data driven. We're looking forward to the opportunity, if council supports staff's recommendation, for us to operate the Navigation Center and share with you on a regular basis the outcomes and the amount of people that we'll be helping in partnership to overcome homelessness here in Oceanside. We work with thousands of Oceanside residents through our programs and partnerships. The proposal we have for the Navigation Center is to increase the bed capacity to operate up to 75 total beds. This will be a seamless continuum of care. As I mentioned, our teams provide the homeless outreach team currently. We're also working in partnership with the Housing Authority to help people, once they are able to secure housing, to be successful in that housing. Our opportunity to come in and operate the Navigation Center closes that loop and allows our teams to work together in outreaching, getting people off the streets, getting people into the center, and most importantly, helping them overcome homelessness. We propose tracking the housing exits, the benefits enrollment, the care engagement. We utilize the local homeless management information system, electronic health records. We work closely with local healthcare providers, we'll share about momentarily. And we have a quality assurance and compliance team, which will be dedicated to ensuring that all of the outcomes that we are committing to in the proposed contract are not only met, but exceeded. Interfaith's outcomes are the result of decades of refined practice, deep community partnerships, and a wraparound approach to care. On the screen here, we have 4 key strategies. The first is that we propose operating a holistic, client-centered program. We're not just offering beds to temporarily house people, we're offering pathways out of homelessness. Every individual, every guest will receive an individualized care plan tailored to their needs through our integrated services model. We will provide behavioral health care provided by licensed clinicians, peer support specialists, and substance abuse counselors. We'll provide housing navigation and placement, employment and income support, and basic needs assistance. Looking to our second key strategic element of our proposal, Interfaith is an organization that has a deep portfolio of programs internally, including the complete continuum of addiction treatment programs, from detox to longer-term residential treatment, outpatient, sober living homes. We also provide recuperative care, and we operate the only low-barrier shelter for families in North County. All of these resources would be available to individuals and households who we would be serving through the Navigation Center. We have a deep behavioral health workforce program. We would be leveraging behavioral health interns to further provide additional behavioral health services at the Navigation Center. And then looking to goal number 3, and understanding some of the significant healthcare challenges facing individuals experiencing homelessness here in Oceanside. We have very close partnerships with local federally qualified health centers. We operate the only recuperative care center in North County, San Diego. We work and have contracted relationships with Tri-City Medical Center, with other local hospitals, and with every single Medi-Cal managed care plan. So we can help an individual, they're in the Navigation Center and they have a health crisis, rather than have them be forced to potentially exit back to homelessness, we can get them the right-sized healthcare that they need or behavioral health service that they need, and then be able to bring them back to the Navigation Center when they're ready for that intervention. This also provides an opportunity to secure additional revenues to further reduce the expense of the operation. Looking at strategy number 4, we are focused on serving adults at this location. We want to be able to provide a place for some of the hardest to serve, some of the most individuals with some of the biggest levels of challenges here in the community, to have a safe place to overcome their homelessness. We know from our experience that happens best in an environment that serves exclusively adults. We will serve families through other means. We will work on diverting and preventing families from having to go into shelter. We have additional philanthropic resources, specifically to help families get back into housing without having to go back into shelter. If they do need to go into shelter, we do operate another low-barrier shelter here in North County. We see an opportunity here to align this resource, the Navigation Center, in lockstep with the city goals, to expand access to emergency shelter, again, increasing bed count, to prioritize Oceanside residents and to provide documentation for where those connections are. And most importantly, the purpose of all of this is not to get people into shelter, it's to get people into housing. So we see an opportunity to get more people off the streets of Oceanside through the Navigation Center and into housing. We have worked with staff on the opportunity to make this transition what we believe can be a very seamless one, proposing an opportunity to take over operations in October. We have the staffing models in place. We have the hiring plans ready to go. If this is approved, we would begin putting that team in place immediately, so that we can work with the current provider and with the city on that transition. Our outreach teams doing the work here daily for many years. Our new Encampment Resolution Fund outreach teams working in partnership with city and other providers have realized success, and we see an opportunity to do even more. So we appreciate the opportunity to share a little bit more about that tonight. We do have a small number of speakers who we've asked to shorten their comments given the time of the evening, but it's important community members want to share their support for what we're doing. And we're very thankful for their support and thankful for your consideration. As I mentioned, our team and myself are here to answer any questions as you may find helpful. Thank you.
Thank you very much. Yeah.